A new deadly virus has emerged in China to destroy humanity. China, we can never forget China. We can never do anything to make them forget it. For the past 5 years, where the data is from, and where to get it. But China has not given that information yet. Suddenly, an emergency call is heard from China. Everyone has a respiratory issue. China is experiencing a rise in respiratory illnesses, including human metapneumovirus, also known as HMPV. What is this virus? Is it a virus beyond corona? It is said that this virus has been with us for 60 years. What is its true nature? We are going to see many such things in this video. In Asian countries, this virus is now widely spoken. As it was spoken in China, in Japan also, many people are being hospitalized. The virus that has come to China is HMPV. It is known as Human Metapneumovirus. This Human Metapneumovirus, HMPV, is a virus that causes respiratory problems. It was discovered by a Dutch scientist, and in 2001, it was found to be a new virus. Even though it is known to be a new virus, due to many serious experiments, this HMPV virus has been with us for 60 years. But in 2001, it came to some people again and again. But now, it has spread to many people in China. When we look at this article, what is HMPV virus? How does it affect humans? How does it affect us? How does it protect our loved ones? You can completely understand this. So, what is HMPV? This is a question that everyone has. Will there be a lockdown again? Or will there be something like this again? If there was a fear like this, there is no need to be afraid now. Because the World Health Organization, or China, has not announced that this is an emergency situation. Before that, we need to think that we can prevent this. So, fear is the first friend for our disease. As we get more afraid, diseases start affecting our body. The first thing we need to do is to be brave. For that, we need to study this HMPV virus well. This HMPV virus is said to belong to the pneumoviridae family. Specifically, this is an RNA virus that belongs to the metapneumovirus genesis. This is a single standard and negative sense. So, closely, this is a respiratory virus. That is, respiratory syncytial virus. So, this HMPV virus is a virus that can survive. This is a normal virus. It has been with us for many years. Even if we find it in 2001, there is no medicine for it. There is no vaccine. There is no vaccine. At the same time, scientists are engaged in research to find the medicine. So, what kind of symptoms does this HMPV virus give us? If we do not take care of this HMPV virus, if we ask whether we will die, there is a risk of dying. This is the group of scientists. Generally, this HMPV virus affects children under the age of 14. It affects the elderly, from 55 to 60 years of age. It affects the elderly. Those who do not have a good immune system, those who get sick quickly, those who get fever, those who get hypertension, those who are like that. China has started to give information that they should be careful about this. So, if we look at the current situation and spread, now, the information has come out that this HMPV virus has spread to the north of China. The news that the people there are in an epidemic situation can be seen in many cities today. Epidemic, the word we heard, coronavirus has become an endemic. So, when we say that there is an epidemic situation, people are afraid of this coronavirus. Again, there was a question whether a virus attack like this can be tolerated by humans. As an answer to that question, the HMPV virus comes to us. So, a respiratory, let's say a virus that affects the breath, even if we have a cold or flu, it will be very difficult for us to breathe there. In Japan, now, an influenza outbreak has been created. About 18,000 cases have been reported through this influenza outbreak by Japan's health industry. But, Japan has not confirmed yet whether there is an HMPV virus in this. So, let it be an influenza outbreak, let it be a flu, because winter season, flu, influenza outbreak, or normal fever, cold, etc. are all common. Vicky. In this, the name of some viruses is HMPV. So, if we look at its symptoms, cough, runny nose, fever, fatigue, difficulty in breathing, all these are its symptoms, they say. What is this, Vicky? These are the symptoms of a normal fever and cold, right? These are the symptoms of a coronavirus. Only at the last stage, there will be difficulty in breathing, oxygen level in the blood will be low. We have read about this in the coronavirus. Similarly, this HMPV is a virus that creates respiratory issues. To prevent this, what the Chinese are doing is, they say, it will be fine if you take some medicine. They are injecting unnecessary medicines. This information has now been received by China. Immediately, the Chinese government says, you, unnecessarily, should not use antiviral drugs. Because, this antiviral drugs, even if it creates a good situation for you, it can create many problems in the future. So, they say, do not use antiviral drugs unnecessarily. So, what is the way to prevent this? It should be healthy, concentrate on eating, sleep well. The last thing is, hand washing, wearing a mask, what we did for corona. They have asked us to do the same again, in the prevention method. That means, HMPV is not a new virus, but because it is spreading very severely, there is a confusion among everyone. There is a confusion whether this will be created like the coronavirus, or, definitely, it is like that, because there are many kinds of rumors, people are in panic mode. Now, you know the complete details. We know what we should do. We ate well to escape from the coronavirus. Some things that we can get as a remedy in our home, we left them. Some things that we do not need, for example, we go out at night, drink something cool, get a cup of coffee through it, it turns into a virus, or, we feel a virus problem in our mind. Do not break our immune system like this, just create an opportunity to live a healthy life, for relationships and for you. Let's see what happens, where it happens. We have seen the coronavirus in 2020 and 2021. It is HMPV, right? Let's take a look. As I said earlier, again in the next video we will discuss the HBV virus in detail.